the modified knot test, which we do to test for heartworm. The formalin mixture that we use is 10%. It's what lyses the red blood cells and coagulates the microflora. And the methylene blue is what stains them, so you can see them in a microscope. Use whole uncoagulated blood. I only have a 6 cc centrifuge tube, so it has to be 1/10. 1 part blood, 9 parts formalin mixture. So to get the proper ratio, you will do a 1/2 cc of whole blood. We don't worry about hemolysis since we're trying to lyse the red blood cells anyway. Our 1/2 cc of whole blood. And do 4.5 cc's of formalin mixture. We have a counterbalance. We pour off the supernatant. Okay. And you can see on the bottom there, where is it? There it is. We have a nice solid packed pellet. There's a better view. Okay. We're going to add our 1 to 2 drops of methylene blue. 1, 2. Mix it around. And get our microscope slide. And we do a small drop in the middle of the slide. A single cover slip, not 2 of them stuck together. Like that. Apply the cover slip. And turn on the microscope. The previous slide. This will be the low power lens. About 40 times. Use the coarse adjustment knob to bring it into focus. There it is. Go up to a 100 times magnification. So use the coarse adjustment knob. Bring it up to 400 times. Use the fine adjustment knob. See, no microfilarium at all. Which means that this dog, my dog, does not have heartworm. It's a modified mouse test. This is the fecal flotation method using a commercial fecalizer. We're going to open the bag. Just a little bit much. Okay. Into the fecalizer. Add a little bit of fecal solution, flotation solution. Mix it up with the feces on the bottom there. Make sure it's good and mixed. Add more until meniscus forms. And we're going to add a cover slip on top. And set a timer for 12 minutes. Timer. Carefully remove the cover slip and put it on top of the slide. Perfect. And then it goes onto the microscope for reading and looking for eggs of various worm parasites. And that's fecal flotation. This is the fecal flotation with centrifugation. Take our feces. Right into the cup. And flotation solution. Okay. Thoroughly mix it. Break it up. Make sure it's good. funnel into our test tube. Gauze to act as a filter. And then we pour our solution slowly. It gets filtered out. Until it's nearly full. Put our cap on. And we will set our tube. Top. Not enough for a meniscus. Place a cover slip on top. And we'll let that sit for another 10 to 15 minutes. The reason you do fecal flotation with centrifugation over just regular fecal flotation is that it's more sensitive and it gets more eggs and cysts. And if you have a fecal centrifuge, it's actually faster because you don't have to wait 10 to 15 minutes. Take off the cover slip and place it on the slide. And then to the microscope to be read. Direct smear fecal testing method. Its main advantage is that it is quick, easy, and doesn't use a lot of materials, but it's also not accurate or enough, not 100% accurate, and doesn't test enough of the feces to be a real good testing method. Take a microscope slide, a couple of drops, it's too much. Try that again. 1, 2, a few drops of solution. A small amount of feces. And we blend it in there. Until it's more of a solution, and we dissolve some of the feces. Get out some of the bigger chunks. Gross. It's thin enough to read through, and there are no large chunks of feces, so I'm going to go ahead and put the cover slip on. Wipe away the sides to keep our microscope as clean as possible, hopefully. And onto the microscope for reading. You want a free catch urine? Usually the best time to do it is in the morning, so it's concentrated. Come on, Dupree. midstream. We didn't get that much, but you get it midstream so that the debris on the outside it gets washed away before you start catching it. And it's the least sterile of the ways of catching urine, but it's also the easiest. Line stick cystosynthesis. I'm going to show you first. I'm going to put some alcohol in there, and where it pools right here is about where the bladder should be. One more time for stability. Sterile syringe. Make sure we can feel the bladder. That's cystosynthesis. Rinse, wash the tip of the penis. Chlorhexidine scrub. Rinse it with saline. Surgical gloves for stability. New syringe. Attach it to the string, get the lead, open it, squeeze out of it. Leave that there. Just leave it. Please. Try without touching the tip. We're going to insert it into the tip. Push until we feel we've hit the bladder. There we go. Don't need that much for your analysis, but we pull the catheter out slowly. There. We've got a canine ear swab. Generally, the patients present with shaking a head or scratching their ears excessively. We have our sterile swabs, pre-filled syringe of saline, sterile saline, wearing gloves. This. not touching the tip. I'm going to moisten it with some saline, just a little. Pull back the tip, hold the tip of the pin. Make sure you're going down into the ear canal gently. That's taking the sample. Now we're going to move it to the slide. This is just one ear. If you want to do a second ear, you have to take a second sample. And we're just going to roll the swab across in a straight line. We're not going to slide it. If you slide it, it causes cell damage. Roll straight across there, and then you can do another line right underneath that one. Give ourselves more sample to look at. And we're going to hit it with the hair dryer real fast to melt some of the excess. Now we're going to use our Dip Quick stains, the fixative, the red stain and the purple stain. Do 10 dips in each. The excess, red, tap off the excess, purple, syringe of distilled water. Gently wash off some of the excess dye. Wipe off the back of the slide. I'm going to set it in here, away from it. We'll finish it, letting it air dry. Now that it's done air drying, we're going to read it under the microscope. We're going to start with low power. Make sure that stage is all the way down. And when we read it, we're going to start at the top left, work our way across, down and across the other way, and down, and zigzag till we're at the end of the sample. You want to read the whole slide. You're looking for bacteria and yeast, and you're going to see some skin cells, epithelial cells. Bring it into focus. There it is. Find the edge. To the top. I'm just going to read across. We're going to switch to 10 times. Bring it back into focus. Read across. across. Not seeing much besides epithelial cells here. Now on to the 40 times. Get back into focus. Nothing but epithelial cells so far. Earwax maybe. And then the next one is our oil immersion lens. Here's a drop of immersion oil. Be careful not to touch the slide. Very carefully bring that into focus. I don't see anything in Bailey's ears. We're doing dermatophore skin testing. We're going to pretend there's a lesion here. We're going to wash it. Distill water. And wipe it. We're going to use sterile hemostats, which you don't use a toothbrush or and we're just going to grab some hair it would be from the periphery of the lesion. We're going to open our dermatophore testing medium. And we're going to take the hair and put it just beneath the surface of the medium. And then we're going to put the lid on loosely. We have our dermatophyte testing results. Our 0 colony growth, no pink fluffy, white fluffy colonies anywhere. We checked it every day for 21 days. Watch for color change, because if it changes immediately, it's ringworm. If it waits a few days, it's another fungus or bacterial growth. Yeah, and then testing from the tubes is a little bit more tricky. I never managed to do it with tape, so I usually use a cotton nip applicator, scrape some of the colony, and then use the cellophane tape, put the colony on the cellophane tape, transfer it to a slide, and then stain it with the lactophenol blue stain to check for dermatophytes. But again, because we have no colonies whatsoever, we don't actually have to. What we'd be looking for is the microsporum canis organisms, which are specifically have 6 cell divisions along them. They're kind of like cigars with 6 cell divisions, and where you can see the walls, at least if it's a ringworm. We're going to do a skin scraping on Fox here. Our microscope slide. I'm going to put a drop of mineral oil on it. We have our 10 blade, fresh 10 blade. Normally we would take the blade and rub it around and use the blade, but Fox doesn't actually have a skin lesion, so we're going to use the back end, just like it's the blade, between the thumb and the forefinger. A little mineral oil on it, or you can put the mineral oil directly on the skin as well, but there has to be a drop on the slide. We would take what would be a skin lesion, and you're going to hold the blade at a 90-degree angle. So it's going straight against the skin. You can't angle it, otherwise you'll cut the dog or cat. And for a superficial skin lesion, you're just going to scrape at the hairs. If it were deep, we would squeeze and pinch and scrape harder until the capillary blood came out. We're going to take our slide and whatever skin cells and stuff we got onto it. And you want to hit the periphery of what would be the lesion. Again, Fox doesn't actually have a lesion. And if you're doing just a superficial one, you don't need clippers with a 40 blade. But if you're doing deep, you should clip away the excess hair. There we go. Before actually doing. We have our skin scraping slide, where we had the mineral oil. We take a cover slip. I'm going to apply the cover slip. Our microscope down there. We shouldn't need more than 4 to 10 power objectives to see our parasites. We're not expecting to see any on Fox, as she didn't have a lesion. There are her hair and skin cells.
All of her nails are grown into her pad on the forelegs. The rear feet are fine. There is a slight ocular discharge from the cat on the right eye. Left eye seems fine. Nothing significant in the mouth and the oral cavity. Gum look fine. I don't see any evidence of petechiation or anything. The ears have just mild amount of wax in them. No evidence it's any kind of infection. And externally, when we looked her over prior, I see no evidence of bruising anywhere on the body, and there's no evidence of external parasites, fleas, or ticks or anything. So we're going to put her into position now, secure her, and then we're going to start the necropsy. So let's just tie the back legs first, just like when we do a spay. Okay, so we have secured her just like we would for a routine spay or any kind of abdominal procedure. I'm just going to clip some of the fur off.
Biopsy jar ready.
Okay, we're going to start by making in the midline incision. We're just going into the abdominal cavity right now. Tissue, abdominal tissue looks normal. The percutaneous fat looks normal. No evidence of any kind of inflammatory process, and again, no evidence of bruising or anything. I'm going to open on the linea alba. Okay, there is no free fluid in the abdominal cavity. Organs look grossly, everything seems to be situated properly. Normal coloration. There is a little bit of a yellowish discoloration to the small intestine, so we're going to pay attention to the gallbladder as we go in further. Okay, I just want to extend the excision a little bit more cranially, just so we can look at the liver and stomach. Okay, so you want to look in here? So the initial findings seem to be something going on here around the liver and the gallbladder. We can take samples of that. The lobes of the liver all look smooth and clean, but there's a significant, oh actually I'm sorry, this is the pancreas. It looks like, so there might be a little bit of a pancreatitis going on. That was the cause here. So we will grab a piece of liver just to be on the safe side. Okay, so you gotta mark that liver. We're gonna mark this liver. Guess we should have planned that better. The gallbladder, when I grab it, I can easily express it. So that looks normal. However, the pancreas looks extremely inflamed. The stomach is empty. Stomach content is empty. And we're going to go just down the intestinal tract, the small intestines. Small intestines seem fine, and everything going into the large intestine, down into the descending colon, seems absolutely normal. The right kidney looks normal, normal architecture. I'm just going to cut the retroperitoneum here just to take a look at it. Feeling the capsule. There's a lot of hemorrhaging to the kidney itself, so I'm going to grab a sample of that also to send in. Kidney itself looks normal internally. That's the right kidney. I'm going to come around now to the left kidney. Similar appearance. Left is similar to the right. Okay, urinary bladder is empty, contracted. And we can see the uterine stub from where the cat was spayed years ago. Just want to externalize the spleen to take a look at it right now. Spleen looks absolutely normal. No evidence of any kind of tumors or anything abnormal with it. It's small, normal in size. Again, all the all the peritoneal fat looks fine, other than there is some staining around the area of the pancreas, which looks like it might be somewhat hemorrhagic. You want to go up into the throw? Sure. All right. Okay. So we have just, what, 2 samples, a kidney and the liver. I guess we might as well, let me just grab a piece of the pancreas just to be complete. All right. So I think my suspicion of it being something along the lines of feline infectious peritonitis, I don't think I have any basis for that right now.
Vaginal cytology. We're going to open our sterile cotton swabs. We're going to wet the tips of them with saline. Far too many here. And we're going to go out to the bowl and spray with spray gel, chlorhexidine, wipe it off, rinse it with saline, spray gel, and we're going to take our cotton swab and insert it at a 45-degree angle. Hit the walls of the we're going to take our slide. We're going to roll the swab up straight across once and then twice. We don't heat fix it. About 10 dips in each. 10, and this is the quick dip. 3 stains, a fixative, 1 stain, and a counter stain. 5, 6, 7, 8, 9, 10. Take it over the sink and rinse it. Distilled water. Gently. High and dry. No oil immersion. Shouldn't need to. Last but not least, I don't know that I went deep enough into her vulva. I see a lot of cornified epithelial cells, but she's spayed, so we shouldn't have that many. But she's spayed, so we know that she's in diestrus or anestrus, depending on how you think about it. Wow, yeah. There are 4 stages of estrus, anestrus, which is very few secretions, no vulval swelling, pale mucosa. It's exactly what Jill had when we did this. Safe to say she was an anestrus because she's spayed. And then there's proestrus. The vulva gets swollen a little bit. There's a reddish discharge. It attracts males, but they do not accept them. There's less red blood cells that you see on the microscope slide. And the cells are just beginning to get cornified. And then there's estrus, which is the actual heat cycle, where they're accepting of males. They attract and accept males. They're anuclear superficial cells, almost all of which are keratinized. There's some bacterial attachment. And then there's diestrus, which is the end of the heat cycle. And less swelling, less discharge. They're not receptive to males anymore. And there's a lot of cytological debris. And that's it. We have Fred, who is our recipient, Fox, who is our donor. These are the serum tubes. Fred's lavender top EGA tube. We're going to take the everything out of here but the packed red cells at the bottom there. I'm going to discard that. That was Fred's. We're going to do the same for Fox's. Super neat. That's what we're discarding. Sorry about that. Take a plain white top tube. We're going to label it Fred as the recipient. And we're going to take 2 drops of these packed red cells at the bottom here and add them to this white top. Fred's. The same for Fox. I'll label the tube first. This is the donor. Same 1, 2. Saline. Foxes first. Foxes. threads. And then we're going to centrifuge these both for about a minute at about 3400. That's done. We're going to once again discard the supernatant. Erythrocyte washing. Just the red blood cells at the bottom there. And we're going to repeat this process 2 more times for each tube until they're thoroughly washed. Say video time, I'm just going to cut that. You can see the supernatant is clear and colorless on both samples. We got a good wash. We're going to discard the supernatant again. This one is out of Fred's tube. This one is Fox's tube. All right. And for our final mix, we're going to take 0.02 mLs of washed packed cells and transfer them into a new tube with 0.98 mLs of sterile saline. We do that, we're going to label this one. This one is Fox's donor. Final wash, suspension. O2. 0.8. There's our 0.98. Our 1 ml suspension. Fox. Fred. Our 0.02. When we go any further, we'll label this as Fred suspension. Fred suspension. There we go. And there's Fred suspension. All right. Now for our major matches. The major, this is the minor. I'm going to take 2 drops of the recipient serum. Fred's here. Fred. We're going to put it here. Two. And we're going to take 2 drops of Fox's Final Wash, or the final suspension. One, two. Our major. We're going to do 2 drops of the Fox's donor serum. To our minor match tube. 1, 2. And then 2 drops of Fred's suspension, or recipient suspension. Do a minor match tube. Shake it gently to mix it. And our control tubes are going to be 2 drops of Fox control. So 2 drops of the donor suspension and donor serum into one red control, and 2 drops of the recipient suspension and recipient serum into the other to make sure that they're not contaminated samples. Fox. Shake it gently. Suspension 1 and 2. And we shake it gently. Let them sit for 30 minutes at room temperature. Then we centrifuge them for a minute. Use our major control. You see it's a little cloudy. A little hemolysis. Same thing with the minor. Here we have our controls. Neither one looks like they have any auto-agglutination. They look pretty clear. D for donor, R for recipient. Fox is our donor. One drop. Fred. Our recipient. One drop. These on the microscope. We have our D for donor. We're only going to do this under low power. And we're going to drop our condenser to raise the contrast and see what we can find. Okay, and I see no auto-agglutination on our donor slide. Just to double check. Oop. And we can do our recipient slide, as we're looking for bright light clusters present with agglutination. Get our 1 drop in there. Go. There. And I see nothing on this one either.